A common misconception, actually, is that if you're pregnant with twins, that you'll need a cesarean section in order to deliver. And that's actually not true. There are a lot of things that will determine whether or not you actually could have a vaginal delivery. In general, it's actually preferable to have a vaginal delivery with twins so that you can avoid surgery. The recovery is significantly faster, and really, you do have two babies at the end of the day. And if you don't have to recover from a major abdominal incision, that would be terrific. So, we do try to help affect a vaginal delivery if it's possible. The key things to figuring out whether or not a vaginal delivery or a cesarean delivery are the best routes for you depend on A, the position of the babies. Without a doubt, the first baby has to be head down. When the first baby is in a breech position, a vaginal delivery is not a good idea. If the first baby is head down, then the question is, where's the second baby? If the second baby is head down as well, then you're an excellent candidate for a vaginal delivery. And really, unless the babies can't tolerate the labor, just like anyone else, a vaginal delivery is the way to go. If the second baby is actually in a breech position or anything other than head down, it'll require some discussion. Because at 32 weeks and above, or at a certain fetal weight, it actually is safe to consider something called a breech extraction of the second twin. What that means is, first baby is born head down, and then your cervix has just dilated and passed a whole baby, which is a very different type of cervix than if you're starting out from scratch. And so it is actually possible to have the second baby delivered breech in that situation. Finally, certainly cesarean delivery is appropriate for certain sets of twins. If the twins are not growing well, they are showing signs of distress, and it seems like going through hours and hours of contractions and labor is not the best idea for them. You'll be on monitoring, we'll help you figure that out, and certainly recommend a cesarean delivery if it's the way to go. Similarly, if the first baby's in a breech position, or the babies are too young for a breech extraction of the second twin, then certainly cesarean delivery is the way to go as well.